bill for further study, because this is the first time these bills have been presented before the committee. And with that, we have a roll call.
Chairman Chacon,
Here.
Senator Lombardi, Senator Burke,
Here.
Senator De La Cruz,
Here.
Senator Golden,
Here.
Senator Lombardo, Senator Picard.
Senator Picard is trying to dial in,
Okay.
and I see Senator Lombardi there.
Okay. And Senator
Sorry,
Sosnowski.
I'm here. Sorry, I was having some difficulties.
Yeah. And
Senator Sosnowski is here.
Yes, okay. All right, we have a quorum.
Thank you. The first bill is a Senate Bill 436, an act relating to labor and labor relations, temporary disability insurance by Senator Golden. Senator Golden, welcome. Can you enlighten us in your bill?
Sure. Good afternoon, everybody. It's nice to see you. As some of you who were there in 2013 will remember this vote, in 2013, Rhode Island made history by passing an expansion of our existing temporary disability insurance system to include paid family leave. The benefit allows for 4 weeks of our TDI to be used for caregiving for a loved one. It is referred to as Temporary Caregiver Insurance. Our TDI-TCI system is based on premiums paid by every private sector worker in Rhode Island, who then may draw upon the fund if they need time to care for themselves or for their loved ones. Since our law passed in 2013, many states and DC have passed more expansive laws. In total, there are 10 programs, including in Connecticut and Massachusetts. When I started advocating for adding family leave to our TDI system, which actually was nearly 20 years ago when I first started doing it, I knew my best hope was to keep the policy as closely aligned to the existing structure of TDI. TDI offers about 60% of wages replacement up to a certain cap. So obviously, for most workers, those benefits are not enough. We know that the minimum wage is not enough to cover basic needs right now. If you have a medical crisis or bring a new child into your home, that's added expenses. Being paid 60% instead of 100% isn't going to help out. Other states with paid leave now have longer leaves. They provide higher wage replacement. They cover more people, and they allow people to care for a wider range of caregiving. So the bill that you have before you does several different things, and we have. I've introduced versions of this bill for years, and we have. And I want to note that I did see the email from Department of Revenue. This bill was drafted with technical assistance from Department of Labor and Training, but certainly we will take into account what Department of Revenue said about needing to clarify the information in it. But this is what the bill does. It increases the number of weeks a worker can use for caregiving purposes from 4 weeks to 12 weeks. It expands the category of a worker can take time to care for the person that they can care for, so that to include their grandchildren, their siblings, and other care recipients. It increases the benefit rate from the current 60% of wages to 90% for those earning minimum wage, and to 75% in 2022 for those earning twice the minimum wage. So it will create a sort of progressive wage replacement, so those who are our lowest income earners and the next tier up would receive more than 60% of their wages replaced. It would include gig workers and self-employed individuals, which are not currently covered by the state law. It creates a mechanism to fund all of this by changing the cap on the wages so that we can pay for this wage increase in wage replacement. And it also creates a tax credit for anybody who is paying into the fund, but the income is too low to actually qualify for being able to get benefits. And lastly, one of the things that we did in 2013 that was the first in the nation is we made sure when people took those 4 weeks, they couldn't be fired for taking them. This is, TDI is a benefit that employees pay for themselves. And so being able to pay for a benefit and not being able to take it means you aren't really getting that benefit at all. So we changed the law in 2013 and said that if you're going to take it for caregiving, you have to be, your job has to be held for you. And this would put more capacity for DLT to be able to enforce that portion of the law. You may have seen the news as well that earlier this week, the U.S. House Ways and Means Chair Neal from neighboring Massachusetts put forth a discussion draft of a paid leave, a national paid leave plan that is historic and would require Rhode Island to increase benefits much in the way that this bill proposes. And today, President Biden also announced a national paid leave plan, which will, we assume will also be talked about in the joint address tonight, that would also require Rhode Island to take these actions. So this plan makes a lot of sense. It makes a lot of sense, particularly for workers who have been really hurting this year and had the impact of COVID. We saw how much families needed TDI and TCI this past year in particular, and we know that it is a great benefit, and this bill will make sure that we are doing the best that we can for all Rhode Islanders.
Thank you, Senator Golden. Are there any questions from the committee for Senator Golden? Being none, our first caller will be Leanne Barrett from Rhode Island Kids Count. Good afternoon, Leanne. How are you? And welcome
I'm good, Chairman.
Welcome to Senate Labor.
Thank you very much. I'm sorry, I couldn't get the Capitol TV feed to work, so I haven't been able to see what you've already heard. But my name is Leanne Barrett, and I'm testifying on behalf of Rhode Island Kids Count and the Right from the Start campaign in support of Senate Bill 436. Is that the right thing you're discussing now?
You are correct.
Oh, good. Okay, great. Well, I'll just move forward with my testimony. You have some written testimony that I submitted in advance, including a national report that compares Rhode Island's paid family leave program, or known as TCI, to other states who have one as well. So we really believe that, paid family leave is an essential part of supporting families with young children. There's lots of research that it makes a really big difference for both the babies and the moms in particular. It improves it reduces infant mortality rates, improves breastfeeding rates, increases the likelihood that infants receive preventive medical care, including immunizations, and it reduces maternal depression and child maltreatment. And we have been a leader. As you know, the General Assembly took decisive action to have us be the third state in the country to have a state-managed paid family leave program, but we have fallen behind some of our peer states in recent years who have caught up with us and surpassed us in some ways. So this bill, the two big things that we support is improving the wage replacement rates, because we do have data that shows that low-wage workers, and this is true nationally, but looking at the data from TCI, and there's a chart in my testimony that shows that the lowest wage workers are putting in money, but they're not likely to actually take paid leave, and that is because the amount, if you make, $14 an hour, you can't survive on 60% of that. So we need to do a better job at improving the wage replacement rates and matching some of our neighbor states who have much higher wage replacement rates that help people actually be able to take the leave when they need it. And the second thing that is a big part of this bill that we support is extending the number of weeks to 12 weeks. This is what the federal government offers their employees. It's what all the new states are offering. It is really seen as the fourth trimester. That is a time period when babies really need intensive one-on-one care. They really should not be in child care. In fact, the American Academy of Pediatrics says that no baby, even perfectly healthy babies, should be in child care until they're at least 12 weeks old, because they need so much intense work. And really, there's lots of countries that offer 6 months of leave or even 1 year of leave, which has been shown to really improve outcomes for children and moms. So this is a really important program that benefits families all across the state in every single legislative district. The other thing about extending weeks is that it really helps dads. 42% of the people who take leave for a new baby are dads, and they only get the 4 weeks. They don't get the disability leave, and it also helps with other populations that are left out often: adoptive parents, foster parents, families that have two moms where one mom gives birth and the other mom doesn't. So the people who don't give birth often don't have enough time at home with their children. So those are the reasons we really support this bill, and we thank the General Assembly for your leadership in establishing this program and being leaders in the nation. And we just recommend that you move this forward to make the needed improvements this year. So thank you very much.
Thank you for your testimony. Are there any questions from the committee? Being none, thank you again and have a good afternoon.
Thank you. You too.
Next we have Kelly Nevins from the Women's Fund of Rhode Island. Okay. We have a little difficulty. In the meantime, there are two people that were testifying in support that we could not contact. One is Rachel Flume from the Economic Progress Institute, and the next one was Pamela High, a physician from the Rhode Island American Academy of Pediatrics. We're all in support. We're on the line now? Okay. Good afternoon, Kelly. How are you?
I'm good. Thank you for taking my testimony today. And thanks to everybody on the committee. My name is Kelly Nevins. I'm the CEO of the Women's Fund of Rhode Island, and I represent many thousands of women throughout the state. You may have heard me speak over the last year about the She Session, which was caused by COVID-19 and its economic fallout, primarily impacting women, and particularly women of color. And unfortunately, this She Session threw into stark relief the gender and racial inequities that result from a country and a state that does not support low-income workers or parents, regardless of their economic status. At one time, Rhode Island was the front runner for paid leave policies, but unfortunately, we've lost that status. Other states have stronger standards now that allow low-income workers to take advantage of their benefits. Our current law doesn't pay enough of a percentage of an employee's salary to cover basic expenses for food, housing, etc. And so our lowest income folks who are bringing new children into their families, they have to continue to work because their income margins are too tight. And we believe now is the time to increase the wage replacement rate so that paid leave is affordable for everyone. Now, you'll know from our support of the Doula Reimbursement Act that the Black maternal mortality rate in the U.S. is higher than any other advanced country. The highest risk for new mothers occur between 7 and 42 days after delivery, which is the time that many new mothers, and particularly Black mothers, are forced to return to work because they have so little paid family leave. Dominique, who is a local healthcare supervisor, was forced to use her 1 month of paid leave before giving birth as a result of a difficult pregnancy. And she said, "No one cuts Black mothers any slack. We're supposed to be everything to everyone without breaking a sweat. It's exhausting." Now, I know that the business community might be interested and concerned about this, and what I would say is that companies that offer paid family leave find that they're 93% more likely to retain workers, including low-wage workers. 70% of companies that offer this kind of leave report an increase in employee productivity and an even higher percentage of employee morale. Other studies show that companies with paid leave policies generally helped or had no impact on their bottom line. And it's important to note that prior to the pandemic, women made up 41% of our workforce here in the state and were the backbone of our child care, nursing care, and hospitality industries. Now imagine if Rhode Island's paid leave laws enabled more of these workers to return to work without fear of losing their homes or putting food on the table for their families after they took time out to care for their family members. The last thing that I'll note here is that we also supported the Rhode Island Parentage Act as a recognition that the definition of family has changed. Similarly, we need to update our temporary caregiver insurance law to update the definition of covered family relationships to include extended and chosen family members. The lack of adequate paid family leave and child care options are the two key drivers currently pushing women out of the workforce. This is a consequence that will have negative long-term impact in the absence of social policies that address the needs of families across their life cycle. We as a state cannot afford to not invest. We can't afford to not invest in improving our paid family leave policies. I ask you to please support this bill. Thank you.
Thank you for your testimony. Are there any committee members that have any questions? It appears not. Once again, thank you for your testimony and have a good afternoon.
You too.
Next, we have David Valise from the Rhode Island Interfaith Coalition to Reduce Poverty. Good afternoon, David, and welcome to Senate Labor.
Thank you very much to the committee chair and members of the committee. My name is David Valise. I'm the Rhode Island Interfaith Coalition to Reduce Poverty Director, and we're here to support 611, 612. And forgive me if 436 is not the right number, but the others, Senator Goldman. So we need Rhode Island to support employers with additional paid sick leave, additional time for COVID purposes, and to expand paid family leave. As a coalition that represents 80 faith organizations, congregations, service, advocacy groups who have come together to fight poverty, we recognize that the importance of taking time off to take care of loved ones and take care of yourself. We continue to see the devastation that this pandemic has caused and the increasing health disparities in our community. These bills address a true and simple fact that sometimes you just need the time. This is also about equality. Less security, low benefit rates, fewer options results in workers with low incomes being least likely to take paid leave, which negatively impacts them all. In fact, data provided by Economic Progress Institute shows that workers with the lowest incomes that make less than $20,000 per year are least likely to access any paid leave in Rhode Island, when these workers in these pockets are the ones that are contributing the biggest shares to those services. Rhode Island has the shortest length of any paid family leave policy in the country, and we need to change that, and we need to start protecting people in our state, help them to take time off when they need it, because taking care of loved ones or taking care of yourself is something that we all need to do in this time of crisis. Thank you very much for your time and for supporting families and workers in Rhode Island.
Thank you, David. That was your testimony for Bill 436, 611, and also you'd signed up for 688. So thank you for your testimony. Do any of the committee members have any questions at this time? No?
Thank you.
Okay, thank you for your testimony and have a wonderful afternoon. Next, we have a corrected number. We have Rachel Flume from the Economic Progress Institute. Good afternoon, Rachel. And also you signed up. Hello? We there? Rachel, you?
I am.
Oh, okay.
I am.
Good afternoon, Rachel. How are you?
I'm good. Thank you, Chairman. I did have some technical difficulties, so I apologize. I will try not to repeat anything that anyone said, but I was late to the party today. But thank you. This is Rachel Flum. I'm the Strategy Director and Senior Policy Analyst for the Economic Progress Institute, and I'm pleased to be here to support Senator Goldman's S-436 and also her other bill 612 and Senator Cano's 611. I'm really glad that your committee is focusing on improving programs like paid leave that allow folks to balance their work and family obligations. During this pandemic, we've seen in stark focus how this country's failure to help families balance those obligations are resulting in women leaving the workforce, which will have ripple effects on our economy and families' lives for decades to come. I'd like to speak first and mainly about Senator Goldman's comprehensive TCI proposal 426. And I'd like to note that we are proud to work with a coalition of partners, including 13 organizations that are weighing in with you today about this bill. They represent a broad spectrum of constituents, including seniors like the AARP and Long-Term Coordinating Council. They represent children, including the American Academy of Pediatrics. They represent those with disabilities, including the Rhode Island Parent Information Network, and those working with survivors of domestic violence. All of these groups know that families in Rhode Island need a more comprehensive paid leave program to allow folks to best balance work and family obligations. So as you know, we started TCI in 2013, and we were the third state in the country to enact that program. Since then, there are now 10 states, including the District of Columbia, that offer paid family and medical leave. And we have learned some things since 2014. We know that people use it, and it was highly helpful for families during the beginning of the COVID outbreak. In 2020, there were 8,800 workers who used TCI, 60% to bond with a new child, and 40% to care for an ill family member. But as David just mentioned, we've also learned that lowest income folks who are most likely to pay into the program are not using it. Those earning less than $20,000 are the largest share of workers paying into TCI at 42%, but they're the smallest group of workers to actually use the program at only 19%. And that's not very surprising given that we now have the lowest wage replacement in the country. As other states have passed leave, paid family medical leave, we've seen that our program provides the least amount of benefits to any other state in the nation. If you look on our fact sheet, you can see how low we are in comparison at 60%. And so it's really an economic justice issue. We know that workers who are making close to or near minimum wage simply cannot afford to take leave and only be out on leave with only 60% of those wages. You know, many of these are the workers that we called essential during this pandemic, and we should support them by allowing them to take care of their family and still bring in their wages. Also, as other states have expanded, we've seen that they have included more weeks. So we now have the shortest number of weeks at only 4 weeks. And lastly, I just wanted to highlight self-employed and gig workers. We saw during the pandemic that gig workers and self-employed individuals are actually real people too. They needed unemployment benefits, and the federal government jumped in to support them. And many of those are folks who are working multiple jobs and trying to juggle those jobs in order to provide for their families. So we should continue to treat them as workers who are providing for those families and allow them to pay into the paid leave program and use benefits when they need time off. It's also worth noting that the Department of Labor and Training, when we've talked about this in the past, wasn't quite sure how they could create a program that would allow folks to pay in. But because they now have been providing the unemployment benefits for self-employed and gig workers, it should be an easier lift to add them in. And just, if you'll allow me just for one quick second, I just want to mention Senator Cano's Bill 611, which is an an important update to our unpaid family medical leave law. Now we only provide 13 weeks in over a 2-year period, which is, really not even 6 or 7 weeks a year if you needed to take time over 2 years. And so her proposal is an important one for folks who might have paid leave through their employer but need to have that job protection to take time off. And last but not least, Senator Goldman's bill number 612 is another proposal that is just common sense. This would just require employers to do what they had to do during the pandemic, which is to provide sick leave for folks who need to quarantine or who need to take time off to get COVID testing. Now it is optional, but even if it's optional, the employers can do it and get a tax credit that completely reimburses them for that leave that their employees take. And so this would just say that since they can get reimbursed, that they should be required to provide that leave. And with that, I will stop talking and answer any questions.
Thank you. Does any committee members have any questions? It appears not. Rachel, thank you for your testimony and have a good afternoon.
Thank you. You too.
Next, we have Dr. Pamela High, who we have now contacted from the Rhode Island American Academy of Pediatrics. Good afternoon, Dr. High.
Hello.
How are you, and welcome to Senate Labor.
Thank you very much. This is my first trip.
Okay, we'll make it easy.
I appreciate that. Thank you.
You can continue with your testimony.
Oh. So thank you very much for this opportunity, Mr. Chairman. I so apologize. My phone silenced the call thinking it was spam. So I appreciate all the work in offering me this opportunity. And as you noted, I'm representing myself as a citizen, a resident of Providence, Rhode Island, for the past 29 years, and also for the more than 300 pediatricians in Rhode Island who are members of the Rhode Island American Academy of Pediatrics. I think, as has already been mentioned, Rhode Island was at the forefront with passing paid family leave legislation, but right now Rhode Island offers the shortest paid leave time in the United States and the lowest wage replacement, which has resulted in our low wage income families being the ones least likely to take TCI even when they're eligible for that. This is such an important program, in particular for families with new children, most commonly newborns. It's very important for a family when they bring a new child and a newborn into their family to have time to strengthen their bonds, the bonds between parents and children, and allow them to build resilience through secure and nurturing relationships. And these kinds of relationships are just essential for optimal early brain and child development. We know that 12 weeks is the minimum that researchers in child development feel is needed to help parents learn about their infants and learn how to care for them, and for infants to learn about how secure their relationship is with their own parents and caregivers. Child development research shows that the optimum amount of time is really closer to 6 to 12 months, as is provided in most European countries. And even better than the 3 months that we're asking for in this piece of legislation. This kind of time, taking time off from work to care for a new child, reduces the incidence of maternal depression. It improves parent-child relationships. It increases breastfeeding rates and how long mothers are able to nurse their babies. It enhances dad's involvement in parenting and increases infants' access to preventive medical care and immunizations. It reduces child maltreatment and even is linked to reduced child mortality rates. So it is truly worth the investment. And also, as you know, allowing gig workers and self-employed workers to participate is another important piece of this proposed legislation. So again, for all of these reasons, I want to issue our very strong support from the Rhode Island chapter of the AAP for this key legislation. Thank you again for the opportunity to testify.
Thank you for your testimony, Doctor. Are there any questions from our committee members?
Could I ask Dr. High a follow-up?
Yes, you could, Senator Golden.
Thank you, Mr. Chair. Dr. High, Senator Golden, my question is, I appreciate so much your testimony about the importance of particularly parental leave, the aspect of it of when you have a new child or newborn in the home. But obviously, children also very unfortunately get cancer or end up in the hospital for any number of reasons and need that caregiving time too, as well as we certainly see a growing number of grandparents caring for their own grandchildren. So I'm wondering if, from your experience as a pediatrician and on behalf of the 300 pediatricians in the American Academy of Pediatrics in Rhode Island, what that experience is like in the benefit of being able to have parents be there in the hospital when a child needs hospitalization and has a serious health condition.
You know, you're totally correct in your perspective. There are many reasons. Luckily, most children are healthy, but a few have conditions, serious conditions that require extensive care either in the home or for parents to be available to children while they're in the hospital. A young child in the hospital without a parent there to soothe and comfort them is a very, very sad situation altogether. So this kind of time is incredibly important. You know, it can happen, it may not be 12 weeks consecutively. Let's say a child has a condition where they need to return to the hospital several times for treatment over time. This can be used in that kind of a situation as well. It doesn't have to be contiguous weeks. So that flexibility is another very important part of the plan to support young children and families. Thank you for raising that.
Thank you.
Thank you, Senator Golden. Are there any other questions? Being none, Doctor, have a good afternoon, and thank you for your testimony.
Thank you so much for this opportunity.
You're welcome. Next, we have George Nee from the Rhode Island Afl-Cio testifying on Bill 436 and Senate Bill 688.
For treatment over time. This can be used in that kind of a situation as well. It doesn't have to be.
George, you got some back feed. You have some back feed.
I'm here.
Whether you have the computer or the television, we're hearing the previous testimony.
Oh, okay. Do you want me to
mute one of them?
I'll mute.
Okay, there you go.
Okay. Am I on now?
You're on.
Okay. Thank you, Mr. Chairman. This is George Nee, President of the Rhode Island Afl-Cio. Thank you for the opportunity to testify. I am testifying in opposition to Senate Bill 436. We, from the Afl-Cio, believe that the present TDI system is in very good shape and works very well. We don't think it's appropriate to expand it, particularly for the self-employed people at this time. Also, this bill would have a substantial increase in the taxable wage base, and this is I think, two significant changes to the present TDI system, which I think is very balanced and works fair for everybody. And I would say at this time that one thing that we could look at that is not in this bill is if we need to do the replacement income, I think a better way to do that would be to increase the dependency benefits to take care of folks that have some children and narrow that gap for the replacement income. So for those reasons, we would oppose 436, and if it would be okay with you, just briefly, I would like to say that we are fully in support of Senator Lawson's Bill 688, which does increase the weekly amount of time that someone could be on TCI from 4 to 6 weeks in the first year, next year, and then 6 to 8 weeks the following year. So we do think the number of weeks on TCI should be increased, and we support doing that in an incremental fashion. So thank you very much for your time today.
Thank you. Are there any members that have any questions? Senator Golden.
I have a question.
Okay, go ahead, Senator Golden.
Thank you, Chair. This is Senator Golden. George,
Yep.
My question for you is, do you think it's possible to make ends meet on 60% of the living wage when you have a medical crisis or a caregiving one?
Well, you're talking about obviously the ideal situation, whether it's unemployment or TDI or other programs, is to have 100% replacement income. We're just not at a point where I think we can afford that right now on the TDI program. So I think in some cases there are situations where between the replacement income and the dependency benefits, people are getting back to their replacement income.
Are there Did you hear that, Senator Golden? Okay, thank you. Are there any other questions of George Nee from the committee? Being none,
Thank
George,
you, Mr. Chairman.
thank you for your testimony. Next up, we have Matthew Netto from AARP. Sorry. We are, the next two people who are testifying on 436, we're having technical difficulties in trying to contact them. So we are now moving to Bill 611 from an act from Senator Kano, an act relating to labor and labor relations, Rhode Island Parental and Family Medical Leave Act. Senator Kano, good afternoon.
Thank you, Mr. Chairman, members of the committee. Thank you for giving me the opportunity to present my bill. I want to say that this bill is pretty simple. What it does is increase the amount of time for parental leave and family leave from 13 weeks to 26 weeks per any 2 calendar years. A few things that I feel is important to know about this bill is that it is about job protection for when we most need the time and for our most vulnerable and most in need. For example, when Rhode Island parents welcome a new baby into the world and moms need time to recover and parents need time to bond, they may not have enough time with our current law. As Kids Count referenced in their written testimony, taking at least 12 weeks of time off from work to care for a new child reduces infant mortality rates, improves breastfeeding rates and duration, and increases the likelihood that infants receive preventive Medicare and immunizations. And 6 months of leave is recommended to promote maternal health and well-being, and 1 year of leave is recommended to optimize child health and well-being. When Rhode Islanders are seriously ill, undergoing treatment or recovering from surgery, for example, or to care for serious ill family members. All of these instances require documentation and are to be thoroughly vetted and confirmed by the treating physician. This bill is not requiring paid leave. While one parental and family medical leave are very important, and I am very supportive of these bills, and thank you to Senator Goldman for her passion and advocacy throughout the years. I'm also supporting and co-sponsoring her bills. Most employees are able to use their time, the sick days and other earned time until it runs out. After that, they might pursue disability or just simply go unpaid. But at the end of the day, they won't have to be worried about whether or not they will still have a job when it's all said and done. And while I am fully in support of offering and expanding opportunities for paid leave through our Temporary Caregiver Insurance and parent leaves, this bill does not speak to that and only speaks to job protection. I will tell you a little bit of why this bill is meaningful to me. I have to say that we have a companion bill in the House with Representative Josh Giraldo. He and I are both new parents, and remembering that when we had the babies, we thought that it was important to have more time if it was allowed for us to have job protection, to have the opportunity to bond with the child, and just for what I stated before. So I really hope that we take this bill in consideration. We think about our families and the most vulnerable people in need. It really means a lot for our working Rhode Islanders that we give them the opportunity to have that job protection. And with that, I would like to thank you and for your time and consideration, and I urge passage of this bill. I'll be happy to take any questions and also say thank you to the people that submit testimony in support and will be testifying.
Thank you. Are there any committee members that have any questions for Senator Cano? Senator Dela Cruz.
Hello, Senator Cano. So you said that it was from 13 weeks up until 36 weeks or 26 weeks?
26 weeks.
26 weeks.
Yes.
Okay, and it was for job protection up until the 26 weeks, correct?
That's correct, in 2 calendar years. So just to make sure that the time will be increasing. And by the way, I'd like to say that we are behind in the United States on giving the allotted time for parents to bond with a child, which Senator Goldman has been very a champion and had eloquently said that other countries really take 6 months to a year because they know the importance of this. So, well, it is important for the other bills. That's why I wanted to make sure that I make a separation. This is about job protection. It's to make sure that if a parent is able to cover, a leave without, receiving income, that they feel that they will take the 26 weeks and go back to a secure job that they will continue, so they have more time with a child or to take care of a family member or so forth.
Thank you. Are any other committee members that have any questions?
Me?
Senator Golden, okay.
Thank you. I just want to thank Senator Cano for putting in this bill. I have the experience of a sister in Montreal, and I became parents within 4 weeks of each other, and she received 50 weeks of paid parental leave that was job protected. And so it is incredibly important that people can afford to take the time off, and that we also make sure that people's jobs are still there for them when they want to and are able to return to work. So I really appreciate her advocacy in trying to increase the amount of weeks that we have as job protection generally in our state.
Thank you.
Thank you. Are there any other questions? Being none, Senator Cano, thank you for your testimony. Next we have Samantha Weiser from the Rhode Island Democratic Women's Caucus testifying.
Hello.
Hello, good afternoon. Welcome to Senate Labor.
Hello.
We're ready for your testimony.
Great. Thank you very much. My name is Samantha Weiser, and I'm testifying today as a member of the Rhode Island Democratic Women's Caucus Executive Committee, testifying in favor, strong favor of Bill 611 and 688. Bill 611, which expands parental leave, is incredibly important for Rhode Islanders and Americans everywhere. The United States is incredibly behind when it comes to providing adequate time to take care of a newborn in comparison to other countries in Europe and around the world. Moving from 13 to 26 weeks will be incredibly helpful both to birth parents who can take more than 8 weeks to fully recover from the process of giving birth and still want time to actually bond with their baby, as well as parents who may be spending time breastfeeding, which can take time for up to a year, multiple times a day, that cannot function with only 13 weeks of parental leave granted. Even so, 26 weeks would still be lagging behind many other countries, in addition by not providing that these weeks be paid. That being said, moving from 13 to 26 weeks will make a huge difference in the lives of so many parents who need time to recover from the process, adjust to life with a new child, and also bond and become a family with that new child. As well, I'd like to testify in favor of Bill 611, which increases temporary caregiver benefits to 6 weeks and then later to 8 weeks. As the Women's Caucus, we know that caregiver responsibilities often fall to women, and it is incredibly important that we provide support and benefits for people that are adequate to the amount of service that they're providing. As the Women's Caucus, we are strongly in favor of both of these bills. Thank you, and I'm happy to take any questions.
Thank you for your testimony. Are there any questions from our committee members? Being none, once again, thank you for your testimony and have a good afternoon.
You too.
We tried to reach two other people on Bill 611. That there is Hillary Levy-Friedman and Mayor Alorza, and we could not contact them. So we are moving to Bill 612 by Senator Goldman, an act relating to labor and labor relations, Healthy and Safe Families and Workplace Act. Senator Goldman, welcome again.
Thank you. I heard a little bit of this testimony as people were talking already, and certainly it would have been ideal if we had been able to hear this bill early in the legislative session. Essentially what happened was last year during the pandemic, the federal package called FFCRA created a tax structure that allowed employers who were to provide sick time for their employees for COVID-related reasons or because schools were closed and childcare were closed. And the federal government picked up the tab to pay for that sick time. Because of the way this last package was agreed to, that mandated leave sunset. And then after President Biden came in, there was another reconciliation process. Those tax credits still exist, and they actually can be used for even more reasons, for a longer use of time for caregiving for yourself and for to your children and family members for COVID-related reasons. So employers can absolutely provide those benefits and then get reimbursed by the federal government. It's not mandated because they couldn't put that mandate through the way the reconciliation process happens. So what this bill is trying to do is require employers in the state to actually use those tax credits. It means they have to provide the benefit, but they get entirely reimbursed by the federal government, and it would be tied to the federal reimbursement of that sick time provisions, and this is exact same provisions designed to work together. This is obviously important because people need that time, and while we are a state that already has a requirement for paid sick days, there are people who just need more time because they've had a medical complication, they've had a more significant reaction to getting the vaccine, any number of reasons related to COVID that they might need a little bit more time. This is a great way to be able to get it. And also it will relieve some of the pressure on our TDI and potentially even our UI system, because people will be able to get payment through this as opposed to the other existing structures.
Thank you for your testimony. Are there any committee members that have questions for Senator Goldman? It appears not. Once again, thank you. And we have one person signed up to testify, and that's Enrique Sanchez. Good afternoon, Enrique, and welcome to Senate Labor. Hello? Enrique?
Yes, sir.
Oh, welcome to Senate Labor.
Hey, thank you so much. I couldn't hear you. Thank you so much. My name is Enrique Sanchez. I represent here the BLM RI PAC and Providence DSA, Democratic Socialists of America. I am here in support of Senate Bill 0612 in relations to the Labor and Labor Relations, Health, Safe Families and Workplaces Act. I am here in support of this bill because I believe that we need to extend the additional paid sick leave time for our employees across the states. And I would also like to add that I think it's really important that we start taking into consideration, I understand the circumstances that we're in, but start taking into consideration the future of having our undocumented community as well, be part of this group of folks that would get additional paid sick leave. Especially now during COVID-19, a lot of folks did not receive their stimulus checks, did not qualify for their stimulus checks or for any government assistance throughout the pandemic. And I think it is extremely, extremely important that we require our employers across the state to extend additional paid sick leave. Many people are struggling. Many people are struggling to pay their bills, their utilities, their health care. And there are a lot of employers out there in the states, which big corporations like Lifespan and CBS and Amazon, that do not offer these options. So definitely target the bigger corporations, bigger companies, because they are taking advantage of our workers and our working people and our poor people. And we have the ability to, pass something within our General Assembly, Senate, to make sure that we look out for our working people throughout Rhode Island. Thank you so much. And thank you so much for the senators for introducing this very important bill.
Thank you for your testimony. Do any of the committee members have any questions for Enrique? No. Thank you for your testimony, and have a good afternoon.
Hey, you too. Bye-bye.
Our last bill is Senate Bill 688 by Senator Lawson, and I've been told that Senator Lawson is on a tour in her school with our treasurer, so this is a bill, an act relating to labor and labor relations, temporary disability insurance benefits, increases temporary caregiver benefits to 6 weeks in a benefit year starting January 1st, 2022, and would increase temporary caregiver benefits to 8 weeks in a benefit year beginning January 1st, 2023. Are there any committee members that have any questions? Being none, that concludes all of the bills we have. So a motion is in order to hold Bill 436, 611, 612, and 688.
I would so move, Mr. Chairman.
Second.
Motion made by Senator, I believe it was Lombardi, seconded by Senator Cisnowski and Senator Dela Cruz. I can see something there. Okay. Will the...
Actually, what it is, Mr. Chairman, is Senator Dela Cruz chooses to eat during the session.
That's what I thought. It looked like a piece of pizza or something. Will the clerk call a roll?
Chairman Chacon,
Yes.
Senator Lombardi,
Yes.
Senator Burke,
Yes.
Senator De La Cruz,
Yes.
Senator Golden,
Yes.
Senator Lombardo, Senator Picard, Senator Sosnowski.
Yes.
Get Senator Burke?
Motion's held.
Yeah. Okay. I believe Senator Dela Cruz's yes was in between two bites.
I move that we adjourn, Mr. Chairman.
Motion to adjourn.
Second.
Second. All in favor?
Mr. Chairman, I would move that Senator Dela Cruz be able to eat a hearty meal.
Thank you.
All right. Thank you for your afternoon of spending time with us on the Zoom or WebEx. Good afternoon, everyone. Thank you.